The European 1+MG Genome Initiative, that's a member state initiative starting 2018 with 13 countries, and it has now increased, so now it's 25 member states and Norway. The aims of the initiative is to provide secure access to high-quality genomics data together with clinical data. And this is in order to improve research, to get better healthcare, including precision medicine or personalized medicine, and also be good for innovation. Now, the project will be very good for putting Europe on the forefront for genomics and genomics research. It will also be very beneficial for the patients because it will enable the breakthrough of precision medicine and personalized medicine across Europe. And also when it comes to rare diseases and other rare diseases, it's of course very good to have access to much data in order to draw any conclusions and also enable research in those areas. In order to realize the initiative, we need to build a digital data infrastructure that is distributed across the member states, is secure, and provide access in a controlled manner across the member states. So the initiative will enable access to data across borders, and this will enable research that were not previously possible to do with larger amounts of data, and also this to have both high quality genomics data and associated patient data that will be instrumental in order to drive personalized medicine forward. Now when we start this infrastructure, it will be genomics data and it should be a high quality, so it should be useful for all countries to be able to access it. I guess that in the future we will also include other types of data, since there are a lot of other omics, like proteomics, metabolomics and so on. But that's in the future. For the moment we start with genomics data. And this data will also be related to other data spaces that are now created, for instance for image data and in cancer data and so on. And very much of this will then be integrated into the European health data space. When we build a data infrastructure now, we make it secure from the very beginning. We have something called that data protection by default and design. That makes everything secure from the very beginning and only open up those parts that need to be open. And this is in order to ensure that the data is securely stored in the various countries and enable with controlled access only to those that should have access to the data. And since genomics data is very sensitive, it's your personal data, we will of course do it as secure as possible. So therefore we have all these databases are protected by default and design. That means it's only controlled access. That means you need to be the persons that will access the data are thoroughly checked that it's the right persons and that also they have reasons to have access to data. For instance, it could be physicians or it could be researchers that need access to data in order to make better research in benefit for patients in the future. Access to the data that will be given to persons that need access. For instance, it could be researchers, it could be clinicians, and they will then be checked that they really have that profession, and there will be a system for controlled access. That means that you need to log on and with two-factor authentication in order to be really secure. There will also be other type of analysis, for instance aggregated data, statistics and other things that could be useful for policymakers, could also be useful for just annual statistics in each country and so on. And those data will not be that sensitive because it's just a number of information about number of people with a certain disease. What we build in the project is to have a user portal that is unified, one entrance point. And there you will also identify yourself. So if you're a person that have access to different data, then you will also get that access seen in the portal. So you will see data from, for instance, Sweden, Spain, Germany, and other sites. And then you'll be able to access those data and do analysis. And in some cases, perhaps also download the data. To be part of the initiative, it will benefit Sweden because we are a small country. We will now get access to data from many other European countries, and this will of course improve research, clinical diagnostics and clinical healthcare, and also be good for innovation. And Sweden will provide data into the 1+MG by LXC Sweden, which have data mainly from the state sector, and the Genomic Medicine Sweden, which have data from the regions, from the hospitals. Genomic Medicine Sweden is a national initiative in order to get more genomics diagnostics implemented in healthcare. And they have now managed, together with the clinical genomics at SciLife Lab, to get the national guidelines implemented for diagnostics in rare diseases and cancer. Because I believe that this initiative also catalyzes activities in both Sweden and in other countries. And that is of course beneficial in order to drive genomics diagnostics forward and improve healthcare in the different countries, and also enable better research and innovation. I like a lot to work with this 1+MG Genome Initiative, because it's will have enormous implications for citizens. It's great also to be able to use the goldmine that large amount of genomic information will be. And it's also instrumental to be able to really realize precision medicine or personalized medicine across Europe and in each country. So we need to do this. I'm also very happy that there's so big enthusiasm among our co-workers and also across the different countries in Europe. So I'm looking very much forward to this, and I am also optimistic that the legal boundaries will also be managed in the future.